To begin to understand the idea of health insurance, we need to look at what health insurance used to be. Back in the day, whenever you get sick, you went to see a man of God or a witch to heal. This developed slowly into places to heal and became hospitals. And with the advancement of the Industrial Revolution, developed into government-funded care. I am rushing through important parts here because I only have a few minutes and I want to get to private healthcare. Government quickly realized that healthcare is open book. No matter how much money you throw at it, it always needs more. Care can become inadequate. It can take a long time to receive the care you need. Folks started to think, let's privatize healthcare. That seems the solution for everything, right? Right? Not quite. Most businesses have two priorities, and both should be achieved at max. Maximize profit and maximize shareholder value. In private healthcare, doctors are encouraged to do all the procedures to make sure that the patient is okay. For a simple headache that requires hydration, you might end up with a bill for thousands of dollars. So privatization was clearly not working, until some genius thought of insurance companies. Insurance company to the rescue. The idea of health insurance works like this. You don't pay the hospital directly, you pay the insurance company. Money that's put into a pool of money to cover the risk of the few. From that pool of money, the insurance pays the hospital. Taking the example of a headache, the hospital could be greedy and ask for an expensive MRI to the brain. But the insurance will say, hold on, this guy could be dehydrated. Run a cheaper blood test to check hydration level. Of course, there is much more complex level to achieving the right diagnosis. So this would be the case if we live in an ideal world. The insurance company has the money, and the hospital has to prove to the insurance company that the patient is really sick. Sadly, a lot of today's doctor work and time going towards speaking to the insurance companies, trying to convince them that the patient they have needs the procedure requested. Remember, this is a simplified look at health insurance. It's not a deep dive, investigated and detailed look at the health insurance industry. It's a lot more complex than this.